Hello everyone, so this is a short video on bandaging. I've got James here to volunteer his arms, and I'm just going to show you two different types of bandaging. So first of all, we'll talk about spiral bandaging. Spiral bandaging is pretty cool for long limbs. It's also good for getting a good tight dressing on, for example, for the hemorrhaging patient. For this, always make sure that your bandage unrolls from the bottom, not from the top, because then you can get caught up as you're rolling it around. And then for the first part, you want to bring the arm to you and then wrap the bandage around twice just to lock it in place. And then spiral up the patient's limb, making sure that you cover half or 50% of the previous layer so you can just wrap around. For this one, obviously you can increase the tension on the bandage, or you can leave it loose if you want to, but that's really about it. The reason we put it on the long limbs is that apparently it doesn't have much mobility if it goes over a joint. If that's the case, then we want to use a different kind of bandage, which I'll show you in a minute. Once we've got to the end, you can either cut if you've got excess, or if you haven't got any extra, to get another bandage. And then once we've done that, we can then tape that on. Okay, rest that on down. Thank you very much. The other bandage that I want to show you is wishbone bandaging, or herringbone bandaging, or figure of eight bandaging, which is pretty good if you're going to be putting it over a joint. So for this one, we start exactly the same way, so the bandage unrolls from underneath. Wrap it round a couple of times again, so it feels pretty similar. And for this one, what we want to do is go up at a diagonal, go around the back of the limb, and then come back at the opposite diagonal, and keep doing that same thing, so we end up with a nice diamond sort of shaped pattern, this nice sort of crisscross pattern, all the way up the bandage. So keep going in an upward angle, and then at a downward angle, and keep doing that. I prefer this one only because it looks really fancy, but apparently it allows for increased flexibility over joints, which is, I think, probably on the whole. How does it feel, James?
It feels really good.
There you go. So very comfortable. So when you got to the end of your bandage, wrap it round, so spiral it again, and bring it over, and then you can ask the patient to hold that in place, and then you can just take a bit of tape and stick that down, and then we have our bandaged patient. Thank you very much, James.
Thank you.
Thank you.